Can someone give me a thumbs up if you can hear me?
I can hear you, Greg.
Thank you. Good afternoon. It's 2:30, so we're going to go ahead and get started. Good afternoon, everyone, and thanks for joining us. My name is Greg Stahl, and I'll be your moderator today. Before we get started, please note that everyone should be muted at this time. Also note that American Sign Language interpretation is available. Search for Interpreter Stubs and hover over the three little dots in the window to lock it in place. We're going to hear remarks today from Director Dave Jepson, Deputy State Epidemiologist Dr. Catherine Turner, Laboratories Bureau Chief Dr. Christopher Ball, and Division of Public Health Administrator Elke Shaw-Tulloch. I'll now hand it over to Director Jepson.
Well, thank you, Greg, and welcome everyone to our press briefing today. We continue to see the effects of a very, very contagious Omicron variant. The week of January 8th, the percentage of those who had a positive COVID-19 test was 25.7% statewide. This is the highest percent testing positivity we have seen during the entire pandemic. Some healthcare providers are reporting in the last few days testing positivity rates as high as 50%. In addition, on Friday, January 14th, there were 3,266 new cases of COVID-19 reported, setting the record for the most cases of any day during the entire pandemic. And keep in mind that there are around 22,000 positive test results that we know of that have yet to be reported as cases. As I mentioned last week, the number of hospitalized COVID-19 patients continues to increase. At the same time, the number of healthcare workers out of work due to being infected or exposed to COVID-19 is high and also increasing. This is resulting in increased stress on our healthcare systems. The current trend continues. It is likely Idaho will enter crisis standards of care for the second time. The data clearly shows that being vaccinated is the best protection against Omicron. And with that, we'll share a chart here. Thank you, Greg. This chart shows how the vaccines are working against Omicron. This is weekly case rate data from November 20th through January 15th for those who are fully vaccinated versus those who are not fully vaccinated, and includes all ages, including adults and children. You can see the increasing weekly case rate due to Omicron that started in late December. While there has been an increase in the weekly case rate for those who are vaccinated, as shown in the bottom line, the weekly case rate for those who are not fully vaccinated is both much higher and increasing at a much more rapid pace. This shows that being vaccinated remains the best protection against Omicron. Thank you, Greg, for sharing that chart. We continue to see many Idahoans every day choosing to get vaccinated or receive a booster. And to you, we say thank you. As this Omicron wave continues, if you haven't been vaccinated, please consider choosing to do so. If you have been vaccinated, choose to get a booster. This will help to protect you from getting COVID-19 and help you avoid going to the hospital if you do catch COVID-19. It's also important for children and adolescents to get vaccinated. While younger people and children tend to fare better than adults, COVID-19 still negatively affects them. A large multi-state study among children in 31 U.S. hospitals found that nearly all teenagers admitted to the ICU because of COVID-19 were not fully vaccinated. If you have questions about the vaccine for you or your children, please talk to your healthcare professional. In addition to choosing to get vaccinated, please choose to wear a mask. Properly worn masks work to protect others and you. Physically distance when in a public space, wash your hands often, and stay home if you're sick. And with that, I'll turn it over to Dr. Turner.
Thank you, Director, and good afternoon, everyone. Thanks for joining us today. I wanted to focus on a couple of metrics that get a lot of attention in the media, and we throw them around, but maybe thought we would take a moment to sort of walk through them, especially now that we're seeing such high incidence and high positivity rates. So the first one I'm going to talk about is our percent positivity. Each week, we look at all of the lab results that have been submitted to the state by laboratories across the U.S. We determine what percentage of the total number of these results for specimens collected during that one particular week were positive, and we get a percentage. The important thing to remember is these data do not rely on case investigations or contact tracing. It is really a review of the records that we have received from laboratories who provide the testing services. The positivity rate helps us monitor what the virus transmission level is in a community. There are things that can impact the positivity rate, including the availability of tests and the number of people who are tested by laboratories versus at-home testing, which is becoming more and more popular to do. So it isn't a perfect measure, but it is one piece of the puzzle that has a lot of data in it that we are able to use to evaluate and assess where we are in the pandemic. Now, as you can guess, the higher the positivity rate, the more concerning it is, because what it tells us is we use it as a proxy for what proportion of the population could spread the virus. And as the director mentioned, our weekly positivity rate is over 25% statewide, and it's the highest rate since the pandemic began. And in general, we want to see our positivity rate no higher than 5%, which would indicate the virus is likely not infecting very many people. So that's one measure that we use. Another measure that we use a lot is case incidence rates. And specifically, we look at the 7-day average daily rate. It is used to compare how many cases there are, and we can use it to compare across geographies. We can use it to compare across other characteristics such as age or vaccination status. Because what it does is it standardizes the population, and that's what makes it a rate. Instead of counting the number of cases in a community, we will calculate a rate because the population of each community might be different. And so in a community with a lot of people in it, of course, they're going to have more cases than a community with a few people in it. And so that rate helps us to compare those two communities against each other or to each other to see if things are going the same or if there's certain hot spots in the state. I will tell you that cases are not counted until local disease investigators in Idaho are able to confirm that the person is a resident of Idaho, and they are able to complete an investigation to gather other important information about that person's illness. They might ask about their vaccination status. They might find out whether or not they were hospitalized. They might ask about symptoms to see whether or not they were an asymptomatic case or a symptomatic case. As you can guess, case investigations do take some time. So when the number of positive lab reports are so high that an investigation is impossible to be completed for everyone in the same day that we receive it, we get what we call a backlog of lab results. And we do display the number of records that are outstanding on our dashboard in order to help people put in context the data that they see on our dashboard. However, we are able to estimate what case rates might look like if those labs had all been processed and a case investigation had been created. So this is just a simple way to count. We don't know a lot about these estimated cases. We don't know were they hospitalized. We don't have their vaccination status because we're just basing it off of that lab report. And what I'd like to do is display, similar to how we did the last time we were together, I'm going to display a chart that illustrates with the blue line on your screen the published 7-day incidence rate that we have on our dashboard. And this chart goes from December 10th through January 15th, which is last Saturday. So the blue line is what is on our dashboard for our statewide 7-day daily incidence rate. Starting about January 1st, that's when we started getting so many lab reports that we could not complete an investigation for every single one of those labs in a day. And that's when these rates start to diverge from what's published versus what we are estimating based on positive lab results. And as you can see, right now, our statewide 7-day incidence rate is 80.56 per 100,000 people in Idaho. So if you took 100,000 Idahoans, 80 of them would likely be positive. It's just giving you that estimate. But if we add to our case investigations all of the lab reports that have yet to be processed, our case rate essentially doubles, and it would be 197.2 people per 100,000. So again, if you take that same group of 100,000 people, almost 200 of them would be a case. And we're going to have a backlog for a little while because our positivity rate is so high and we're getting so many lab results. But this is a good way that, we look at this and the percent positivity as a way to kind of measure how things are going in communities. And as you can see from that gold yellow line, it looks very similar to our percent positivity trend, which is what we would expect to see. And with that, I am going to turn it over to Dr. Ball to sort of get into the testing arena a little bit more deeply. Dr. Ball?
Thank you, Dr. Turner, and good afternoon, everybody. I've got just a few updates for you. First off, I'll just kind of touch on what we're seeing locally. And as no surprise to many of you, local availability for over-the-counter rapid antigen tests is incredibly unpredictable. This stems from the fact that there is way more national demand than retailers can ever support. And so what that means is that the day-to-day access, whether in-store or online, is likely to change very quickly. So for those of you who are looking for rapid antigen tests here locally or those that you may want to order online, what we would recommend is to look at multiple retailers and multiple sites and to check back frequently because their inventory may change quite rapidly. We're also hearing that access to PCR testing locally is also available, and it's available free of charge through a variety of federally participating pharmacies like Rite Aid and Walgreens and some other Ridley's locations throughout the state. So check with them to see what their availability is for appointments. And there are a lot of urgent care sites that have the ability to test you for COVID-19 too if you're seeking a COVID test. There's also some federal updates that may be of help in coming weeks. First off, the recently announced site for ordering free COVID tests, up to 4 per household, is being beta tested today and prior to its official launch tomorrow. So that site is covidtests.gov. It has been published to our Idaho coronavirus testing website and also is available for you to enter information in advance of that going live tomorrow. So that's a completely free service. Up to 4 tests per household will be mailed out. It's anticipated that it will take about 7 to 12 days from the time the order is placed before that gets shipped via United States Postal Service. So while these tests may not be available immediately for use, it may be good to have them on hand if the pandemic, as the pandemic continues to grow. Additionally, as of last Saturday, January 15th, the federal government has ensured that private health insurance and group health insurance will cover over-the-counter tests that are purchased at local online shops or retailers. So any test that is authorized by the FDA is allowable to be reimbursed through your insurance, up to 8 tests per covered person per month. So that means for a family of 4, you could order up to 32 tests and get those tests reimbursed by your insurance. The reimbursement rate will be the cost of the test, or $12 per test, whichever is less. Additionally, insurance companies will cover an unlimited number of tests that are ordered by a clinician. So if you're seeking medical care and it's determined that a COVID test is required for you at that time or on an ongoing basis, your insurance provider will cover those tests as well. So this hopefully will make it much easier for folks in coming weeks to both access tests as well as make them more affordable. Additionally, the federal government is also providing rapid antigen tests to participating federally qualified health centers. And the Division of Public Health, in association with the Idaho Primary Care Association, has been working with sites to make sure that they know how to sign up to receive those tests. And we anticipate that they should be receiving more tests and making them available for folks that use their services in the coming days. The last thing that I will talk about is there has been some reports in the media and through the FDA that these rapid tests may not be as sensitive in detecting Omicron as they were with previous variants of concern. There's still a lot of data that needs to be gathered to be able to make this determination. And some of the early laboratory-based data might suggest that Omicron has poorer performance during the early stages of infection. However, most of the laboratory data that I've seen has been for tests that do not currently have an emergency use authorization in the United States. I think that there's a lot of information yet to be determined about the sensitivity of rapid tests with Omicron. But just in general, I think it's important to note that rapid tests across the board, regardless of the variant of concern, do have a lower sensitivity than PCR tests. And so we would expect that there would be a bit of a delay between the ability to detect an infection early on with an antigen test versus a PCR test. I guess I'll conclude by saying I know that there's a strong demand for testing statewide, and testing may not be available. And if a test isn't available, that's okay. If you have symptoms, stay home. If they worsen, seek medical care. And do your best to distance and wear a mask when in public settings so that we can try to reduce the amount of transmission that we're seeing. And hopefully within the coming weeks, testing availability that is both convenient and affordable will become more available. With that, I'll turn it over to Elke Shaw-Tulloch.
Great. Thank you very much, Dr. Ball, and welcome everyone. So as you've heard from the previous presenters, we are certainly seeing a rapid rise in our COVID cases, especially since Omicron became the dominant variant. And while it's not yet driving additional patient populations into the hospital at the same rate that we saw before Christmas, we're clearly seeing more and more people getting sick. I know, for example, I'm seeing it in my own daily life, and I'm sure everyone else is as well. As I go about my daily routines, I see more bare shelves in the grocery stores and other stores. I see delays in some of the basic services that I'm trying to get, such as my vehicle being serviced, for their long lines and checkouts, and due to employees out sick. Or they're out caring for family members or have been exposed to someone. I personally also know more and more families who are experiencing situations where they're being impacted almost one child at a time, causing some significant challenges for families trying to deal with kids that are in the school setting. The impact of the pandemic is very real, and it's very much continuing right now. We get asked quite a bit if the pandemic is over, and you see it quite frequently in news articles. And we also get asked if it's over and if the virus is now endemic. And while we all very much want this to be over, get back to some sense of normality, public health professionals do not feel that we are currently have transitioned from calling this a pandemic into an endemic. We have still too many people worldwide that still don't have the protection against the virus. People across the globe lack immunity, whether that's through natural immunity from having had COVID or from achieving that immunity through getting their vaccines, as well as the number of people getting sick continues to rise, which is not something that you would see if a virus is endemic. In Idaho, we see anywhere from hundreds to currently thousands of cases a day, and we're continuing to see COVID surge in these unpredictable waves. The virus continues to mutate and evade immunity, and this is not something that you would see for diseases that are endemic. We don't know exactly how long this will last, and we're also hearing that there are claims that we are able to stop taking protective measures because the virus has become endemic, and this simply is untrue. We need to strengthen our protective and mitigation measures against the virus right now to keep it from spreading and mutating, and to keep our families, our friends, our colleagues, and our employees healthy, and our doors to our businesses, schools, and healthcare open. As we continue in the pandemic, and to reiterate my message from last week, in addition to getting vaccinated and boosted, it's incredibly important to wear a mask. While any mask is better than no mask, we encourage you to increase the quality of your mask. Everyone ages 2 and older who are not fully vaccinated should wear a mask indoors in public places, and CDC recommends, and we endorse, that masks should be worn indoors regardless of vaccination status in areas of substantial or high virus transmission. Currently in Idaho, 43 of our 44 counties are considered high community transmission. For some better perspective, according to CDC, a person who is not sick can get sick from an infected person if they're within 6 feet for 15 minutes and neither of the people are wearing a mask. If they both have cloth masks on, that time increases to 27 minutes and up to 60 minutes if both have surgical masks on. For even more protection and longer lengths of time, a KN95 mask is ideal for the general population. N95 masks that you might see available should be reserved for our healthcare as they require special fit testing. If you do not have access to KN95, a paper surgical mask is the next best choice. And to increase the effectiveness of that paper mask, you can also pair it with a cloth mask over the top to hold that paper mask closer to your face. Properly worn masks to protect others and to protect you. Your mask needs to be able to cover your mouth and your nose, as we've talked about before. It should fit snugly against the sides of your face so you don't have any gaps. You should have a nose wire to prevent air from leaking out the top, and you should not have exhalation valves or vents, which allows the virus particles to escape the mask. So to switch gears a little bit, last week I provided a call to action from our healthcare partners to donate blood to better enable them to provide the best care, the best and available care to their patients. This week, our healthcare partners have requested, and I'm asking that you please do not go to the emergency department for a COVID test if you do not have symptoms. There are other places to get asymptomatic tests. Dr. Ball just mentioned that we have the new federal site where you can order those free at-home tests. It's up and running at, again, to reiterate, covidtests.gov. We encourage you to plan ahead and order some tests to have them on hand. The emergency department should only be reserved for those people who are really sick and need symptomatic testing. Additionally, I want to point out some new resources that we have available on our website at coronavirus.idaho.gov. We have several new resources, one showing the new CDC guidelines for isolation and quarantine for healthcare, the general population, and K-12 schools. And additionally, we have several new resources on therapeutics, including a general overview of the various types of therapeutics that are available, a link to the therapeutic distribution locations, and information for clinicians on the new oral antiviral medications for COVID-19. And finally, I would be remiss if I didn't continue to plead with all Idahoans to do what it takes to turn this around. Get vaccinated. If you're vaccinated, as the director said, thank you very much for doing that. Get your booster for added protection against Omicron. Get tested if you're sick or if you've been exposed. Stay home if you're sick. Wear a mask with the highest level of protection possible and keep your distance from others. With that, I'll turn it over to you, Greg.
Thank you, Elke, and thanks to all of our presenters today. So we'll now take media questions. Please raise your hand in WebEx or type your question into the chat area. And when I say your name, you'll unmute yourself and announce your name and media outlet before asking your question. Then clear your hand when you're done. I'll do my best to take your questions in the order that you ask them. A quick scan. Audrey, I saw your hand first. Audrey Dutton.
Hi, good afternoon. Audrey Dutton from the Idaho Capital Sun. I am curious, we see a lot of are they in the hospital with COVID or for COVID? And that's always, that's been a thing throughout the pandemic, but with Omicron, people are wondering about the incidental testing. People testing positive when they're in for surgery or a car crash or something like that, that it might be more than with prior variants. What can you tell us about COVID in the hospitals right now? Are they vast majority actually symptomatic? Are they there for it or with it?
Yeah, thanks, Audrey. That's a great question, and we do get that quite frequently. And seeing Dr. Turner's reaction, I'm going to turn it over to her.
So, Audrey, as with every question you ask, the answer is it's complicated. When we do a case investigation, we specifically are asking, did the person get hospitalized for COVID-19? That's what put them in the hospital. So when it comes to our case data, the hospitalized cases data is they were hospitalized because of COVID. When the hospitals are reporting their data into the the national system that comes out as HHS Protect, the question is whether or not that person is an inpatient who also has COVID-19, whether they came in to, I don't know, deliver, mom coming in to deliver and she happens to test positive, or somebody who's in there because they had shortness of breath, they're suffering from the symptoms of COVID. So it's pretty hard for us to tease it out. What we try to do is we try to compare our case data to the hospital data so we can get a pretty good idea about that. Unfortunately, because we are so far behind on case investigations, our data are behind as well on hospitalization. So I can't give you a great answer to the question, but I can at least explain to you kind of how our data kind of works together to give us the full picture.
So when you're doing those case investigations, what are you seeing? Is it different from with Delta?
Well, it's a tricky question because we've got 22,000 outstanding positive lab results. So there's a lot of missing data essentially. So I can tell you that we are not seeing as many cases hospitalized as we did back in, the fall. But I can't tell you whether or not that's because the investigation hasn't been completed yet or because that person hasn't been in the hospital. So we're in a sort of tough spot right now because we're so behind on investigations.
Thank you very much.
Okay, our next question will be from Kyle Ponnenstiel.
Thanks, Greg. This is Kyle Ponnenstiel with Idaho Ed News. I wanted to ask about the wave of school closures last week and bleeding into this week. What's happening and how is the new variant playing a role?
Thanks, Kyle. And I'll ask Dr. Turner to kind of backfill this as well. I think what you're seeing in the school setting is just a direct reflection of what's happening in the community. As cases are increasing across communities, more and more kids and more staff are getting ill, and therefore it's having an impact on the school setting. We're providing as much support as we can to schools to help them with their COVID testing response. We've talked about that in the past on these briefings as well. But I'm going to venture a guess that Dr. Turner will say the same thing, that the reflections of the community. Kathy?
Yeah, thanks, Elke. That's absolutely correct. This has been true since the beginning of the pandemic. The rates of illness among school-aged children are a direct reflection of what's going on in the community. And as a reminder, the most common place people get COVID is in their own household. So it is the perfect opportunity to spread it amongst your family. So if one person gets it, it's likely everybody in the household will get it.
Okay, moving on, our next question will be from Shira Matsuzawa.
Hi, thanks, Greg. So we talked, I believe it was last week, that we talked about monoclonal antibody treatments and how some are less effective when it comes to the Omicron variant. So can someone talk about, I guess, what the treatment options are that are available and who they're going to specifically?
Yeah, thanks, Shira. This is one where we wish that our Dr. Hahn were on the call right now as someone who's really been taking the lead on that. I don't believe we have anyone here, any of our physician colleagues, to help us give you more detail, but we can certainly make sure that we address that better in next week's media briefing, unless Dr. Turner, you have anything you want to add that you can, or?
Yeah, I think one thing that I would say, Elke, is that the Pfizer product, Paxlovid, they just released some results, I think it was just today, that they found that that it was effective against Omicron in laboratory tests, and that's a really encouraging early sign that that drug, once it's available more broadly, will be an important tool.
Thank you. Real quick, actually, I know we've talked a lot about, treatments going towards those who are immunocompromised. Can you kind of clarify exactly what that means? Is that someone who has RA or cancer? I guess kind of just a breakdown of it.
Yes, also a great question. And I think probably the best recourse would be to make sure that we note your questions, and we'll make sure that we address them head on next week when Dr. Hahn is back. Certainly, if you go to the references, the resources that I cited during my opening remarks on our coronavirus.idaho.gov site with the therapeutics, you'll be able to see a side-by-side comparison of the different therapeutics, what they're used for, what the populations are, if you want more detailed information. But to give you the best conversation, I think it'd be best if we had Dr. Hahn on.
Thank you.
Okay, Tristan Lewis, you're up.
Hi there. So we've gotten a few messages from teachers and parents just about concerns over transparency when it comes to case numbers on school districts' dashboards. There's some school districts that are only reporting cases of students and staff that were infected while they were at the school facility and not reporting an overall amount of cases. Let's say if somebody were infected outside of it and adding that to the dashboard. Is there a level of expectation you guys expect for your school districts in Idaho to have on their dashboard while being transparent?
Thanks for that. Certainly, we'd like as much transparency as possible, and we encourage that. And we encourage the school districts to give community the information that helps them make some good informed decisions. But as you know, it is local control, and they do have their own responsibilities to provide that information, and we don't kind of dictate or mandate what they provide, but we do encourage that for sure. Dr. Turner, I don't know if you have anything else you'd like to add to that.
Thanks, Elke. I think the other thing I would add is that we do have a dashboard. So if you go to the Idaho coronavirus website and you click on schools, one of the very first things you can click on is the school dashboard. And the data there are the data that are submitted by the schools in Idaho. It's updated weekly. But we added a feature this year that also includes a breakdown of cases among school-aged children. So that gives you a pretty good idea of what the case rates look like in at least the student population that might be going to school, and so you can kind of get a better picture. But those data are provided by schools to our local public health districts, and then it rolls up to the state.
Thank you.
Okay, our next question will be from Ian Stevenson.
Thanks, Fred. Ian, thanks, Greg. Ian from the Idaho Statesman. Dr. Turner, I wanted to double check something that you said earlier, just to make sure that I'm hearing you correctly. Are you saying that the positivity rate data that the state puts out is completely separate from the case investigation data that's done by the state, meaning that any backlog in the state data is not affecting the positivity rate data, or other backlogs are not affecting that weekly data?
Go ahead, Dr. Turner.
Yeah, Ian, you're absolutely correct. As I mentioned, the positivity rate data are basically a record review. It doesn't rely on anybody reaching out to the patient. It doesn't rely on, well, it relies on a little bit of data cleaning, but other than that, it is based on the records we received. It is separate from case investigations.
Thanks.
All right, our next question is from Rachel Cohen.
Hi, Rachel Cohen with Boise State Public Radio. I was wondering if maybe Director Jepson could talk a little bit more about what hospitals are facing right now. I know we mentioned the number of staff members out sick, but just wondering if there's any more details you can put on that in terms of what hospitals are describing right now and how it differs from what they saw last fall.
Thanks, Rachel. Director?
Thank you, Rachel. Excellent question. And I certainly will defer to my hospital colleagues for specific numbers or situations with specific hospitals. But generally, what we're seeing is a dramatic increase in the number of staff that are out either because they have COVID or they were exposed to COVID, or as Elke said, taking care of somebody at home with COVID, which would leave them in the exposed category. And that's in some cases as high as a 10-fold increase, meaning 10 times as many staff are out now as they were at the end of December. During the Delta, and then if you look at the number of staff that are out now versus how many staff were out during Delta, we also are seeing numbers that are orders of magnitude higher than we saw during the Delta wave that just took place towards the end of last year. And that's really down to the fact that this Omicron variant is very contagious, very much more contagious than the Delta variant. And our healthcare workers live and work in the community and are out among friends and family and school functions, et cetera, and are as exposed as anybody else that would be in those situations. And so that's what we're seeing in the hospitals and our healthcare systems is tenfold increase in people out due to COVID, where we only saw maybe a 2 or 3-fold increase during the Delta wave. That obviously impacts capacity, and many of you have seen that some providers have had to curtail some of their operations, including some of their primary care or urgent care operations because of lack of staff, which is always concerning. And it's caused the hospitals to be very creative in how they run their staffing at the moment. We continue to provide staffing support with our federal partners, and that continues and will continue at least through March. At least at this point, and that's been helpful, highly helpful to the hospitals, but they're struggling. And what that really means is even though we haven't seen as dramatic a rise, at least yet, and we keep our fingers crossed that that's the case, in the number of patients going to the hospitals, that is increasing, and you can see that data on our website. But the combination of increased patients with decreased staff, if we were to get back into crisis standards of care, that's likely due to the decreased capacity as much as it is with the increase in number of patients. So thanks, Rachel, for the question.
All right, we will now, we've gone through our list. Audrey Dutton, another follow-up.
Yeah, thank you. Director Jeppesen, this kind of relates to the question you just answered, but can you talk about the effect of long-term care staffing shortages on the ability of hospitals to discharge patients?
Yeah, Director?
Well, Audrey, excellent question. And the short answer is dramatically and much more impact than we saw during the Delta wave. And the reason is that long-term care facilities are struggling in general just to hire staff, as many employers are throughout Idaho. Coupled with a very high, just like the healthcare workers, infection rate among their staff, causing them to be out of work, many more than have seen at any other point in the pandemic. And so if you're a long-term care facility, such as a skilled nursing facility, and a hospital calls and says, I need to discharge this patient, but they're not ready to go home, they need to come to a lower level of care that you provide at your facility, and you don't have the staff as a skilled nursing facility to support that patient, you don't have the ability to take them. And that is actually causing patients who are ready for discharge to stay at hospitals until either something opens up at a long-term care facility or they get well enough that they can be discharged to home. And we're actually seeing the largest, we saw that through the last wave and at the end of last year, that be a problem, but we actually have seen it be an even bigger problem just here in the last 2 weeks. And again, it's just simply where you have patients who are ready to be discharged and there's not room for them at the skilled nursing facility and they're not ready to go home. And so that causes them to be housed at the hospital.
Okay, another question from Ian Stevenson.
Thanks. This is for Director Jeppesen. I realize this is difficult to predict and that these things move quickly, but you were saying that the state may need to go into crisis of standards of care again. Is that something that you potentially foresee the state being on the brink of in the coming days or the coming weeks, or what sort of timeline might we expect?
Director, your crystal ball.
Yes, Ian, if I had that magic 8 ball that always was correct, I could give you an exact answer to that. What I can say is that if the current trends continue, meaning we continue to see this level of number of cases and this level of number of people going to the hospital, we would expect crisis standards of care probably in a matter of measured in weeks, probably not days, but it would be sooner than later. Now, that depends on a lot of things, Ian, as you just said in your question. So I'm not forecasting that as a prediction. I'm just saying that the current trends tell us that it would be a matter of in the near future of when we would be there. I wouldn't say it's imminent. I would say near future.
Thank you.
All right, our next question will be from Jeremy Stiles.
Yeah, hi, Jeremy Stiles from KTVB Digital. We've heard from a few folks who said, hey, I've got conditions that put me at greater risk, immunocompromised, various things. And I feel like right now I can't really leave my house. I feel trapped. What kind of advice, or what advice would you have those people who, I guess, are looking to live life as best they can, but keep themselves safe. Don't want to take chances with this so contagious right now.
Jeremy, I think you've hit on a great question there, and I think you've heard the answer that we've said over and over and over again. I mean, get vaccinated, and if you are vaccinated, get the booster shot. And we know that some folks are not able to do that, which is why it's so important that people who are around people who are immune compromised do that to help protect those individuals. But certainly, we've talked about upgrading masks. We talked about limiting social interactions and all those things, and just really making sure that they're kind of appropriately living in their environment, so they can venture out and they can do things. But there are tools available to them, first and foremost, by getting the vaccine if that's appropriate for them, considering their healthcare conditions. And see if I have any other colleagues on the line here who want to add anything else. Kathy, or you want to add anything else on there? Nope. I guess not. We'll move on. Something happened to Dr. Turner.
Okay, Audrey Dutton, do you have another question?
Oh, no.
Okay, and
I don't. Sorry about that.
And Shira, I saw your hand was up and now is not. Was your answer or question answered?
Oh, it got answered. Thank you.
Okay. We have a decent amount of time left and no remaining hands in the air. Reporters here, do you have any further questions? Oh, there are two popped up. All right, Audrey Dutton.
Yeah, I just am feeling exhausted with this whole everything, and I'm wondering how you all are feeling. Director, how are you feeling? What, almost going into our third year now?
Director.
Well, Audrey, thank you for the question. It is. I think we're all tired of this. I think all of us, including myself, wish that we weren't having to deal with a pandemic, and it is tiring. There have been points during the pandemic where I personally have been really exhausted, and I know that's the same for many of the staff that work here and across the public health districts, and certainly in the healthcare settings that provide care to folks and just people in general. And we're not immune from that, and we feel those same things. And so, but every day is also interesting and brings a new challenge. And that's part of what keeps us going, is to really make sure we stay focused on doing the best we can to serve the people of Idaho, to provide the best information we can, and hopefully make that difference in one individual life. And that's really what keeps us all going, is focused on the individuals and the families of Idaho, and how do we best help them navigate this really difficult pandemic. So yes, it's tiring. Yes, it's exhausting, but we're here till it's over, and we hope it's over soon.
Okay, and another question from Ian Stevenson.
Thanks. Just a question about the positivity rate, which is so astronomically high at the moment, both from the state data and from the Director Jepson, you mentioned some of the local or other providers who do their own testing also showing extremely high rates, up to 50% right now. I wondered if there's any indication that those percentages are skewed in any way, somehow inflated or deflated due to the numbers of people getting tested or any other factors, or does that seem to be just where we are right now with community spread?
Great, thanks, Ian. I'm going to start with Dr. Turner and see if Dr. Ball has anything to add.
Thanks, Elke. And I apologize, everyone. I left Elke hanging earlier because the battery went dead in my mouse and I couldn't click to unmute myself. So, technology. So Ian, it's a great question. And the short answer is there are a lot of things that can impact percent positivity. The population that you're testing, how frequently you're testing. If you're doing surveillance testing, you might get a lot of negatives because you're just testing everyone. So the short answer is there are things that can impact it. However, it's the best thing we have. And one of the reasons that we limit our percent positivity calculation to molecularly based testing is because it's the capacity doesn't tend to go up and down like it does with other testing modalities, and we get great reporting from the labs that are providing that level of testing, and it's a little bit more reliable. So all of those things add up to our percent positivity being something that we feel pretty confident in. And then I'll just turn it over to Dr. Ball to add anything from his perspective.
Thanks, Dr. Turner. I think that you summed it up quite nicely. I mean, for the window that we have on data that are reliable, that's probably our best estimator. But I think that it's also equally likely that there are a number of people that could be positive that are not seeking testing that we have no visibility on. So it is an estimate, I think is probably the best way to put it, but a reliable one.
All right, a question from Vinny Del-Giudice.
Thank you, Greg. This is Vinny Del-Giudice at Bloomberg News in Denver. Regarding testing in Idaho, what variants are you seeing at this time? Omicron, Delta, anything new, anything old? And do you have a percentage breakout of which one is more prevalent at this point? Thank you very much.
Yes, thanks, Vinny. We do have that information available on our website, but I'm going to turn over to Dr. Ball to give you the verbal.
Thanks, Vinny. So I can report on what sequences have been in international databases that are submitted from people being tested in Idaho. And in the most recent 2 weeks, they've been almost exclusively Omicron. So I think that we're on the tail end as we see data start coming in for samples collected in the first 2 weeks of January. I think what I'm expecting to see is that Omicron will probably completely displace Delta, much in the same way that Delta displaced Alpha.
And anything down the road at this point?
Well, that's always a very tricky question to answer. Much like the director, I wish I had a magic 8-ball that could predict things. The one thing I'll tell you, Vinny, is every time I've hazarded a guess on what was going to happen next, I'm almost assuredly been wrong. So I'm not going to hazard a guess as what could come after Omicron, other than to say until we get this pandemic under control, all of the conditions are ripe for another variant to emerge. So I'll leave it there.
Thank you. That's why I avoid the horse racing track. Have a good afternoon.
Okay, seeing no more hands in the air, no more questions. Yep, no more. So with no more questions, we're going to wrap up for today. Note, let's see, that we're going to have another media briefing a week from today, and we'll see you then. Thank you all.